Bowel and bladder function following a stroke. This module provides a short overview of the bladder and bowel problems that can occur following a stroke. We will talk about incontinence and why it can happen. What does it mean to have urinary frequency or retention, and the risk of developing a urinary tract infection. Bowel problems such as the risk of constipation, and some strategies to try and avoid these problems. Incontinence means poor control of your bladder and/or your bowels. It can affect many people after a stroke. Many people recover control of their bladder and bowel function soon after the stroke, but for others, the problems may continue for a longer period of time. Problems with incontinence happen for different reasons. Sometimes it is because your stroke may have damaged the part of the brain that controls your bladder and/or the bowel. If you already had bowel or bladder problems before the stroke, the incontinence may have become worse. If you have difficulty walking or moving around, or you need help getting to the toilet, you may not always be able to get there in time. Sometimes you may lose control if you have troubles getting your clothes off in time. If you are having troubles communicating and cannot make yourself understood in time, you may not get to the bathroom in time. Any extra exertion involved in moving may make it more difficult to maintain control of your bladder or bowels. Sometimes medication can affect your bladder or bowels. For example, a type of medication called diuretics, which helps to lower your blood pressure, may affect your bladder control. It is important not to stop the medication without first talking with your doctor. It can be very upsetting to have lost control of your usual bladder or bowel functions after a stroke. Frequency is the need to pass urine more often. Urgency is when you get a sudden, uncontrollable urge to pass urine, and this can make it hard to get to the toilet on time. If you don't empty your bladder properly, this can also lead to infection. It is important to know the signs of a urinary tract infection. These can include a frequent need to urinate even if your bladder is empty, burning or pain when urinating, strong or bad smelling urine, cloudy urine, fever or chills, stomach cramps, or a sudden change in behavior. If you notice any of these symptoms, you need to let your doctor know right away. It is important to talk to your healthcare team about what is causing your incontinence. They can help you identify ways to deal with it. Things that you can do include going to the bathroom at regular times, such as every 2 to 3 hours, whether you feel you need to go or not, and calling for help as soon as you feel the urge to urinate so you can have help to the bathroom. Other strategies include drinking plenty of hydrating fluids like water throughout the day, limiting your caffeine and alcohol intake as these promote dehydration, and make sure you have privacy as well as the time to sit on a toilet or commode. Constipation, or the inability to have a regular bowel movement, can also occur as our eating and regular movement routines are often disrupted. Diarrhea is loose bowel movements, and bowel incontinence is being unable to control the release of stool, and this occurs when there is damage to the area of the brain that controls messages to these muscles. Bowel incontinence may also occur if you are not able to get to the toilet on time. Constipation can be caused by not drinking enough fluids, your diet, not being as active as you normally would be, and the side effects of some medications. Constipation can also be caused by being unaware of the need to have a bowel movement after a stroke. Weakness in the muscles that help you have a bowel movement can lead to constipation, or being unable to ask for assistance to manage your bowels. To help manage problems with constipation, try to use a normal bowel routine based on your habits before your stroke. Give yourself privacy. Get into a sitting position and use gravity to help by being in a sitting position for your bowel movement. Other strategies to manage constipation include stimulating your bowels to move by being as active as possible throughout the day and eating a healthy diet. The following are some safety tips. It is important to make sure the path to the bathroom is clear. You could use a night light, use a raised toilet seat, and if you can't safely get to the bathroom, you may need to use a commode or urinal, especially at night. Remember to ask questions and let your healthcare team know if you are having any bowel or bladder problems.